evening and welcome to Canal Afou. Thank you for your loyalty every first and third Wednesday of each month. You know how it works. We interview two experts on a practical topic, and of course, we look forward to your questions and comments. You can send them online in the section reserved for you on your screen. Today we have a slightly special program because we are going to talk about a surgical technique for a condition known to be thankless and for which many of us would rather pass the case on. Others, on the contrary, persist in making mistakes. We're talking about urethral stricture. So thank you to François-Xavier Madec and Bernard Boileau for sharing their experience with us. Gentlemen, thank you. So we are going to discuss together a condition that is more common than people think, and above all, which probably suffers from a lack of proper management. So François-Xavier Madec, speaking personally, when I do a urethrotomy, I make an incision. And when I see that it comes back, I ask the patients to self-dilate. And overall, I'm fairly satisfied with that. Am I wrong or not?
So indeed, that's not the optimal choice of technique. So first of all, the indications for urethrotomies are quite limited. They're for bulbar urethral strictures that are less than 2 centimeters.
For the penile urethra, no urethrotomy?
Yes, it's better to avoid urethrotomies on the penile urethra. And
so for what reason? Does urethrotomy cause damage?
So urethrotomy is effective for short strictures, but if it's repeated, it can indeed cause damage to the proximal and distal urethra, which increases the length of the stricture.
So did we also have the idea that urethrotomy, a Boileau, damaged the underlying tissue? We talked about fibrosis, but is that really something significant now that we can self-dilate?
That's true. Personally, I would prefer that we don't talk too much about self-dilation because, in fact, it's a palliative treatment. That is to say, once you start self-dilation, it's quite rare to be able to stop, so it ends up